New guidelines recognize the vital link between brain and heart health. The medical community is undergoing a paradigm shift, with newly released clinical guidelines formally acknowledging the deep connection between brain and heart health. For years, these organs were often treated as separate entities, but the 2026 C-Change CMAJ guidelines represent a major step forward. They offer clinicians 11 harmonized recommendations to address both conditions simultaneously. This isn't just academic. It directly impacts how you should approach your own healthcare. Cognitive screening for atrial fibrillation, patients' atrial fibrillation, AF, the most common heart rhythm disorder, has long been linked to increased dementia risk. However, formal screening recommendations were absent until now. The updated guidelines now mandate routine cognitive screening for AF patients. Early detection allows for proactive intervention, whether through lifestyle changes, medication adjustments, or closer monitoring. If you have AF, discuss this with your doctor. Depression screening for heart disease. Patients, the relationship between depression and heart disease is bidirectional and complex. Depression worsens cardiovascular outcomes, while heart disease can trigger or exacerbate mental health issues. The guidelines now recommend routine depression screening for those with coronary artery disease, CAD. The suggestion to use selective serotonin reuptake inhibitors, SSRIs, as treatment is notable, as outdated concerns about their impact on heart health have been largely debunked. If you have heart disease and haven't been screened for depression, bring it up at your next appointment. Intensive blood pressure control. A brain-heart strategy intensive blood pressure control is now recommended for patients at high cardiovascular risk, and for good reason. Lowering blood pressure aggressively has been linked to a reduced risk of cognitive decline and dementia, not just heart attack and stroke. This is because your vascular system extends beyond the neck. What benefits your heart often benefits your brain as well. However, intensive control isn't for everyone, as it can cause side effects like dizziness, particularly in older adults. Discuss whether this approach is right for you with your healthcare provider. The unexpected benefit of vaccines may offer protection beyond infection prevention. According to the new guidelines, influenza, pneumococcal, and shingles vaccines may reduce the risk of stroke, heart attack, and dementia. The exact mechanisms are still under investigation, but chronic inflammation driven by infections is a known factor in both cardiovascular disease and neurodegeneration. If you're not up to date on your vaccinations, this is a simple, low-risk intervention worth discussing with your doctor. Shared decision-making. Taking control of your health, the guidelines formally recommend shared decision-making between patients and clinicians, using evidence-based decision aids. This is crucial because many recommendations, such as intensive blood pressure control or vaccination timing, involve trade-offs that depend on your individual health profile and preferences. You are not simply a recipient of care. You are an active participant in your own well-being. Questions to ask your doctor. Should I be screened for cognitive decline, especially if you have AF? Have I been screened for depression, especially if you have heart disease? Is intensive blood pressure control right for me? What's my target? Am I current on vaccinations? Should I consider pneumococcal, influenza, or shingles vaccines? How do my brain and heart health connect? And how should I monitor that connection? Ultimately, these guidelines represent a significant shift in how healthcare professionals approach brain and heart health. Rather than treating these as separate domains, the emphasis is now on recognizing them as interconnected systems that influence each other. While you don't need to overhaul your life overnight, this is an invitation to initiate a more integrated, holistic conversation with your doctor.